Hello, I'm Diana Keogh, Editor-in-Chief of ShareWork.com. Today we're talking to Dr. Anne-Marie Brooks, who is a pulmonologist with the Children's Asthma Center at Children's Healthcare of Atlanta, Hughes Spalding. Dr. Brooks has agreed to take questions that have come in over the internet from our members about childhood asthma. Dr. Brooks, our first question has come in from Peter from Atlanta over Twitter, and he asks, can you outgrow asthma?
True asthma is not something you can outgrow. But like allergies, it's something that has peaks and valleys. So there may be years that you have minimal symptoms, and then you just need the right circumstances or the right sequence of events to trigger another attack. What we're finding the longer that we look at patients and these studies that go on for many years is that asthma tends to be most severe in the first few years of life, kind of tapers off in the school years, may go away during adolescence. Pregnancy, however, often brings things back. And then 30s and 40s are when symptoms really start to rear their head again. So I'm not sure if adolescents are just better at ignoring their symptoms or if it truly goes away. But the ability to respond to a trigger or the risk of an exacerbation never completely leaves somebody that has asthma.
Dr. Brooks, this question was posted on our website. This mom asks, are there really no long-term effects of taking steroids to control asthma?
In general, no. Using inhaled corticosteroids is just like using hydrocortisone on your skin. It's a very low dose. It goes exactly where you need it to go, and very little of it gets absorbed by your body. But any medication can, in an individual child, have some effects that may be of concern. Typically speaking, it's why your pediatrician should follow your height, your weight, and if parents notice any behavioral changes while on these medications, it's something you should talk to your pediatrician about. In the long term, we have no known side effects. While you're using the medicine, very few patients may notice a change in their height, but that reverses as soon as you stop the medication.
Dr. Brooks, this is a natural follow-up question to the last question, especially for those parents that are concerned about the side effects of the steroids. Are there any alternative medications or natural products that parents can use that will actually prevent a flare-up or prevent inflammation?
So not so much reactivity, but definitely inflammation. There's been a lot of research and studies looking at healthy diets in general, those diets that are high in antioxidants, such as vitamin E, brightly colored fruits and vegetables, the healthy fats, such as that you find in olive oil and canola oil. These are called the Mediterranean diets because those are things that come naturally in Mediterranean people, and they tend to have less inflammation in general. In terms of vitamins, vitamin C has often been talked about. However, the dose that you need for vitamin C is much higher than typically we can get in average multivitamins, so we don't necessarily recommend that. Vitamin D has been shown, though, to have a lot of anti-inflammatory properties, and you'll notice more and more physicians are recommending supplementing that.
This question came in from Facebook. If a child is suffering from an asthma attack and doesn't have his medication, what do you do?
Definitely what you want to do is control the breathing. Really try very hard while you're getting help or getting somebody that has access to the medication to slow down that child's breathing. Reduce anxiety as much as possible. Have them breathe in through their nose, breathe out again through lips that are pursed or puckered, and try to minimize the amount of coughing. So helping children either take small sips of water. Medication is the only thing that will truly consistently break an asthma attack, but at least that can buy you a little time while you're helping. There are some physicians, and while this isn't very well studied and researched, in a remote setting, EpiPens sometimes can be used and can be helpful for patients in a very severe attack, and there's no other form of medication available.
Dr. Brooks, thank you so much for joining us here on ShareWork.com. This has been great information. If you'd like more on the topic of childhood asthma, please go to our website at www.sharework.com.